Hi, this is Dr. Shu from Line Plastic Surgery. Today we'll be talking a little bit about rhinoplasty. One question we often get from patients is what part of the nose can be changed with rhinoplasty? And in fact, we think about a couple different areas of the nose when we surgically plan for rhinoplasty for a particular patient. The most common actually is a tip. Most people want to have a tip that's a little bit up, a little bit more protruding, and something that gives them a little bit more nicer look and a little bit more definition in the front. That's by far the most common request we get. And the tip can be improved in various methods. Oftentimes it involves a few sutures to kind of define the tip a little bit better with regard to the underlying cartilage. A lot of times we will use some cartilage from other parts of the body to kind of augment this and make this a little bit higher. My preferred approach is to go behind the ear because it heals very well, but people take the cartilage from different areas. That's probably the most common. The second most common area is actually the bridge. Very often for Asian patients, they'll want an implant or something to kind of raise that bridge and make it a little bit higher, give them a little bit more projection from the side. In non-Asian patients, very often there's a little bit of a hump here, and so often we'll shave that down to make that a little bit smoother. And those are probably the two most common requests we get with regard to the bridge. And the third area that will change, although it's not quite as common, is what we call the ala, the sides of the nose, where some people feel the sides are a little bit too wide, or they want it just changed or just altered in height in different ways. I would say overall those are probably the three most common areas. The tip by far the most common, and then the bridge, and then the ala. So what are the steps that I take to achieve these results, or how do I do my rhinoplasty? Typically, I start by just lifting up the skin and fat away from the underlying structure, which is essentially the bone and the cartilage, because those are the structures that really give the definition and the shape to the nose. So first I'll get exposure, just lifting it up and being able to see exactly what we're dealing with. Next, I'll focus on the bridge. I sort of go from the top down. It's kind of an easy way to think about it. If there's a hump, I'll shave it down. If there needs to be an implant, then I'll kind of dissect off the tissue so that I have enough room to place the implant, and then kind of measure the implant correctly and place it carefully. From there, I'll go to the tip, and that's sort of, for most patients, the crux of the operation, the most important part. We basically assess it by looking first at the skin, seeing what we have in terms of how thick it is and if there's extra skin or not enough skin. And then we'll look at the cartilage, and I'll make a few adjustments with some sutures to kind of essentially usually pinch the cartilage together to make it a little bit sharper and have a little bit better definition. In a lot of patients, they may need some cartilage at this point, and so at this point I may switch over to the ear, take a little bit of cartilage from the ear, and then shape it correctly and place it on the tip here. And then finally, for those patients that want some changes to the ala or the sides of the nose, I may put some stitches or may make some adjustments to the cartilage to move things sort of inward or reposition in different ways. But the most common request is to move it inward because some patients feel their ala just sitting a little bit wide. And from there, basically the structure and the kind of the key parts of the operation are done. Then it's really just a matter of putting the skin and fat back in place, sewing it closed, and I'll put a splint on them, do a little bit of taping, and that's pretty much it. So very often patients will ask if they are a good candidate for rhinoplasty, or who is a good candidate and who is not a good candidate. In my opinion, when I see patients, I usually try to get a sense of what they're looking for, and I think the patients that I'm most comfortable operating on, where I feel they're good candidates, is sort of if they have a pretty clear idea of what they're looking for, and if what they're looking for is reasonable given what they have. For example, sometimes I do get patients where they have a very, very large nose and they want it shrunk very, very small. There's some degree to which we can achieve that, but we usually can't get it really tiny if they're starting with something really large. Fortunately, the majority of our patients are very reasonable. They specifically want the tip a little higher, they want the bridge a little higher, they have very, very specific requests, and those can be accommodated. Patients who are not quite as good candidates, besides the ones who are looking for too much of a change, I would say are sometimes patients have had a couple rhinoplasties before. We do have some patients who come in here who've had 3 or 4 surgeries already. They've always been dissatisfied with it. I would say that those patients aren't as good candidates. Number one, because if they've had a few surgeries, sometimes it means that it's a little difficult to understand what they're looking for. And the second also because with prior rhinoplasties a few times, they can get a lot of scar tissue, and that makes it very difficult to achieve a really nice result. And we always wanted to achieve a great result. So I would say those are the patients that are not quite as good. If you think about, for example, like the Michael Jackson nose job, which is sort of famous, One reason why there have been reported to be complications with that and part of the skin not healing right is because it was done so repeatedly. And so I think for those patients who've had multiple nose jobs before, I generally don't like to operate them quite as much. So if I had to say sort of the secret behind rhinoplasty or getting a good result with rhinoplasty, the key thing is, I think, for the doctor and the patient together to decide not to overdo it. I would try to keep the goals reasonable and have good communication. And without overdoing it, you can achieve a really great result.